channel. And this month of September is my vacationing month, and I'm happy to announce that I'm in the United States of America. Yes, and I have been able to link up with some of my friends, and here with me today I have Wale. Wale is a registered nurse, and like you all know, the aim of this channel, Wale, as I told you, is to help young professionals that are actually confused on what next to do at different stages of their career. Some people are actually just stuck. They don't know what they want to do. They don't know how to even start, or they're stuck in between the process. So I think I'm trying to bring up all of my friends, my people in my circle, just to help them understand how your journey has been, just to help these people have the process faster, a lot faster. So this is Young and Corporate series. Hi everyone again. So hi Wale.
Hello.
So nice to meet you.
You too.
Yeah, so typical question. So I know that you're registered nurse in the US, and I know that's so much of a big deal for a lot of people, especially people in diaspora. I know a lot of people actually migrate to the US just to become nurses here, because it's so much of a big deal. But you were born here, and I know that the process might be a little bit different from people coming from outside the country. But can you just run us through your journey as a registered nurse? You could go as far as when you actually knew that this was what you wanted to do. You could go as far back as your kindergarten. Just run us through the journey.
Kindergarten maybe is too far. But where do we start? Let's start from even coming out of high school. Because coming out of high school, you have this idea of, I want to maybe do this or maybe do that. But you're not 100% certain on that idea. You're just going off the what's going around you, what your parents have been telling you, what you think or deem as successful. So out of college, I wanted to be an engineer. I was so good at math. I just loved everything about math. And when I went into college, I did calculus 1, calculus 2, calculus 3, ACE 5. It wasn't until I got into physics. I don't even know how I passed that physics class, but I was just like, this is not for me.
This is not it.
This is math. Yes, is one thing. Physics is like so, I'm totally different. So complicated. I just could not put two and two together, but I still ended up passing, and that's kind of where I started to look at other things, because I know engineering has a lot to do with physics. Physics engineers, they put two and two together, and with physics, and that's just one aspect of me that I just could not handle. So I started to look around. I actually took off for a semester, and in our community, that's a big deal. You're not doing anything for a semester, but hey, I took off for a semester. I was going through it. I didn't know exactly where I wanted to go. I was just doing some 1 or 2 small classes in community college. And my mom, she just came up to me one day and she said, "Why don't you look into nursing?" I said, "Nursing? No, that's not for me." That's the first thing I said. That's not for me. Without giving it any thought in the long run, or just sitting down and just reflecting on it.
You were even young at the time.
I was even young at the time, so my thought process probably wasn't even fully developed enough to even think that far ahead. And so time was going on. I wasn't doing nothing, just taking my small classes. And semester 1 went by. Then the semester 2 went by. I'm in another small classes. And not anything as my end goal. I'm just taking classes. And we are into semester 3 again, just taking classes.
Oh boy.
Then we're into semester 4, just two whole years.
I can't imagine the frustration at that time.
So many things just going up and down between my head, and I didn't even know how I even dealt with it. Man, we like to keep everything bottled inside. So semester 4 finally went by. I came back home. Oh, I missed this part. All this time, I wasn't even home. I was in College Station doing all of this. Going to Blend Community College. So I was in College Station doing all this. I finally came back home, and then she mentioned nursing again to me. You know, my dad, he's also a nurse.
Oh, yeah, that's a nurse.
My dad's a registered nurse. So he mentioned nursing again to me. At that same time, I started getting emails from the school that I eventually went to, and it started making me look into the profession of nursing.
Okay.
So I said, you know, I'm 24. I've taken all these classes, nothing to show for it. Let me go actually do something, work towards something.
Yeah.
Well, 23 at that time. So I finally got into nursing school, which was Chamberlain College University, is in Pearland. And
can you say that a bit more clearly?
Chamberlain College University.
Okay, Chamberlain College University.
Yes,
okay.
It's in Pearland. And the school was actually 2.5 years, so 2 years and a half a semester. So I started that, and I'm going to college. I'm like, wow, this is really nice. The amount of people that I was meeting, because I was doing clinical at that time, the amount of things that you see going on, saving lives, talking with people, then you're hearing their stories, just the connection that you make. I'm like, you can't get that anywhere else but at the hospital. And when I finally got into that, that's when I realized that this is actually where I want to be. And I'm happy I chose that path.
So it's so funny that you actually did not know that at that time when you were in middle of frustration or before that time, you never knew that you needed that connection with people. You didn't know that you actually could make an impact with people just by connecting with them. That's so amazing. And I think that I was able to draw that it's actually a blessing to have someone that just keeps pushing you, especially at a point when you're confused. And that was your mom for you.
The reinforcement that she always brought. Just telling me, remember, you can always go to nursing. Your dad was a nurse. Your sister was a nurse. And it's a path that's for sure, it will always be there.
Yeah.
It's always sturdy.
Yeah, steady.
Like you don't have to worry about anything.
It's not something.
And it's not just like you have to stay stagnant. You can keep climbing up the ladder.
True.
You can keep climbing up the ladder and go into other professions.
And that was enough motivation for you to just say, okay, you know what, I'm gonna try this.
Exactly.
And that just explains some of the confusions that a lot of young people are experiencing in their career. You are just hell-bent on one spot. Just imagine that you had decided that, oh no, I'm just going to keep going engineering way, and you kept failing physics, and you had to drop out eventually, and then you have to start over maybe at 26 or 28, and you're like, you know what, okay, maybe I just listen to my parents. So if you're out there, I hope that this just motivates you. It's not too late and it's not too early to decide a different path, just like you did. So there's this question from the story that you shared. At that point where you were frustrated, what kept you? Because you said you went back for second semester, you went for third semester. Other people would have dropped out because you just felt, oh my God, this is not it. Maybe I'm not just supposed to be in education. I'm not supposed to go to school. I'm just supposed to just drop out, start something different. So what motivated you to just keep going for the next semester?
It's a little bit between having the freedom of being outside. I think leaving also prolonged me from staying to doing what I was doing there. It also helped me be like, okay, well, financial aid is paying for this. My job is paying for this. And so I will be able to handle this by being outside away and being free from like all the daily stress of not going to school to be towards something. And also, just that time, I didn't really have that many classes on my GP, on my, what do they call it now? Transcript. On my transcript, I didn't have that many classes there, so I needed more classes to take. I was taking basic classes, and I was just going back. So, you know, some of these basic classes, some people, they take 3-4 classes. Me, I was just taking 2.
Oh, okay.
I was just having fun taking 2 and stuff like that. So, yeah, that's just every day. being able to just leave and go back, that's just really the reason why I personally
kept going.
I kept going, yeah.
Okay, so while you were at the nursing school, what were the challenges that you faced? And if you could just tell us some of the challenges that you faced while in nursing school, and what kept you going. I know there's the part where there's your mom to go back to, and she has to ask you, so why?
It's not only it's not only your mom actually. Yeah. When you're in nursing school, you meet different people. All of you guys are starting at the same time, and you're all trying to reach the same end goal. So you can always share your frustrations with those people around you. You know, being able to find your maybe one or two people that are just, you know, focused and grounded like you, and you guys hold each other accountable. You know, every day during that school, you study with each other, you remind each other of tests or important things that are due, and you know, you can share your frustrations with them because they understand you. You all, you know, having the same problems: the long hours of studying, the hard tests, the stress of this is coming up if you don't do this, but you can't move on. And the thing about nursing school is they have a thing where if you fail 2 classes, that's it. So that's always in the back of everybody's mind.
Really?
I'm telling you. So you get it removed, and then you have to appeal. You get one time to appeal. If you fail another one, that's it.
Wow.
That's if they even approve your appeal. So and there's sometimes, you know, in every school there's always some classes that are just really, really hard. There's some professors that just are not really good at teaching, you know, and that's everywhere. And of course, there's some in the school that I went to, so we all had the same stress levels, the hard tests. They're not really understanding what's going on, but have to teach ourselves. And you know, those people in my group kept me going. The end goal of knowing this is what I'm going to be getting, or this is what I'm going to get when I'm finished, that also kept me going. And prayer also kept me going.
Prayer. That's one big one there.
That's the biggest one.
That's a very big one there. Yes. So I kind of drew from everything that you said. That's from the nursing school challenge, that you sort of emphasized on the importance of a community of friends or group of people that you could always like communicate with, just at the point of frustration, schoolwork, outside schoolwork, just in that whole. And can you kind of buttress on that a little bit more?
What do you mean?
Like the community of friends that you had,
right?
That you could always go.
It's always important. It's always important choosing the right people. Like, I didn't go to schools specifically to make friends.
Yeah.
But when you get in school, it's always better to have friends.
Yeah.
That are
like-minded
and focused. Because there's always people that, don't get me wrong, this is not a slate to them. We started together and we didn't finish together.
Yeah, true.
And you don't want them on your friendship group because they can drag you down.
True.
So it's important to choose the right people that is like-minded, focused, and will help you get to that next goal that you're trying to get to at the same time.
I agree. Totally agree. Thank you for that buttressing that point. So I understand that in nursing there are different specialties. So in what area are you specialized? My area
is cancer.
Oh my God.
Right. That was actually my first clinical that I worked at. It was MD Anderson Cancer Center, which is actually the best cancer hospital in the world. And when I got there, I just saw the teamwork, the technology, everything that was the innovation. Everything is something new. Every day something new. And I was like, wow, this is really nice. But I didn't understand that importance until other clinicals, when I'm going to other hospitals, and I'm like, well, this is nowhere near MD Anderson. I'm comparing you guys to MD Anderson now. And when I finished, I finally said to myself, that's where I want to work. I want to work there. I applied there, but you know, they actually take a while longer than every other hospital to hire you. So I applied.
Your current company.
Right. Yeah, my current
employers. Okay.
So I applied there. I graduated in May. I applied for MD Anderson in April because you can apply before.
Okay.
I applied in March, April. I applied there and I didn't hear anything back. So I'm graduating. People are saying, yeah, I'm going to I got hired by this. You know, when you're walking across the stage, they say your back bio and everything. They'll be like, you got hired by this place. Me, I just said MD Anderson because that's what I didn't, even though I hadn't got hired at that time. Okay. I'm just saying MD Anderson, that's where I want to work. And that's what they're saying on bio. So, Memorial reached out to me. They wanted to hire me. I didn't give them an answer yet. And right when I was finally about to get them an answer, MD Anderson emailed me.
Oh my God.
And they said,
just what you wanted.
Just what I wanted. I've been waiting for you guys.
Yeah.
They emailed me and they wanted to do an interview. So I did one interview, and then as I was about to do that interview the day before, a different department emailed me and said they want to do an interview too, same MD Anderson. So now I have 2 interviews at MD Anderson that happened to be on the same day. And when I did the interviews, I did them really well, and I got hired for both. So now I'm having to choose between if I want to do leukemia or
leukemia.
Leukemia was one unit.
Or cancer.
Or no, leukemia is cancer. So
leukemia. Oh yeah, blood cancer.
Yeah, blood cancer, exactly. So leukemia or GIM, which is internal medicine.
Oh, unit. Okay.
And so I went with GIM because leukemia is one specialty. GIM is
another specialty.
It's not even a specialty abroad. They do everything. So
that's like general.
Medicine. So we get everything comes through there. So I get to experience everything.
Yeah.
In that unit. So I did GIM and I got hired. And
you had to make the choice.
I made that choice. I'm actually I don't regret making that choice because even now I get to the different people that I get to meet, the patients, their different things always going on with them. I'm like, wow, I'm learning something new every day.
Wow, that's in cancer.
In cancer every day.
That is. I'm gonna go back to interview, but before that, I would like you to just sort of. You mentioned that you've just mentioned general medicine, GIM, and then you have mentioned cancer. What are the other specialties that just
within cancer or within
nursing? Nursing.
Oh, they have so many. They have even have plastic surgery. That
okay,
people can
nursing.
Go into. I'm telling you, they have anesthesia. They have medical, where they have what do you call it? Med surge. They have. And that's just, when people get surgeries or things like that, they go to that unit. They have rehab where you can just, you don't have to do too much. They even have outpatient where you just sit behind the desk all day and you just, do maybe minimal things. They have hands-on things so where you can fast-paced ICU. You're always there. Or they have things where it's just slow down, calm down. There's not too much to do. They have a vast variety of everything. Dialysis. They have pediatrics, they have so much, emergency, everything.
So if you're watching and you are actually on the path of nursing, you could just think about everything that he's mentioned and just pick your niche. But you already mentioned how you actually picked your niche. You had the experience, you had the first-hand experience during your trainings, and then this is where I want to be. So I'm going to move you on to interview. You had 2 interviews on the same day.
Yeah.
That would have put some people off the track. I would have, a lot of people would have lost their balance there. So tell us how you approach interviews.
So how I approach interviews, my very first interview was with Memorial Hermann. And
wait, what?
Memorial Hermann.
Okay,
Memorial Hermann.
One of the hospitals here. Okay.
And I was really scared because my first interview, I didn't know what was going on, and I'm looking up questions of what to answer or what they may ask me or how to answer. Yeah. Having 2 papers of things that I wrote down for the interview just in case they ask me this, and I was just flustered. Even when the interview started, I was still flustered. I was flustered. They were just telling me to relax, blah, 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 relax. I finished that interview. I was like, man, there's no way I got the job. So then 2 weeks later, it was the MD Anderson interview the same day. And I had those same papers, but this time I said, I'll go through these questions one time, but I'm going to just think about what I need to say when they ask me this in my mind. And this is around the answer I'm not going to have a direct, exact answer, just around the answer of what I'm going to mention, how I want to approach it, a way that, sounds professional, a way that sounds good, and a way that's also the truth.
Yeah.
So when they would ask me these questions, I'll just relate it back to my past experiences. My past experiences and how I got there, and they're like, that's a good answer. So my first interview was with one lady, with my boss, which is, her name's Nicole, she's my boss right now. And my second interview was with two individuals, and I just speak, like, it was just so easy that time. Like, compared to my first and second, it was so easy. I think if it's for anybody else out there, what I would advise, do a practice interview with somebody else around you. Just do one there, and that'll help you.
That will help. Yeah, that's insightful, because you just sort of have an idea of, just don't have a direct answer, because you could just forget what you practice.
Exactly. Once they ask you something that wasn't in your mind already, your mind will just go like that, right? You just get so frustrated.
Yeah. So you have sort of taken us through the steps and the requirements for getting into being a registered nurse in the US. However, a number of people that may be watching this channel someday may decide to want to move to the US to just get a job. So I'm not sure, I don't know if you have an idea of how that works, or if you've had people that have moved into nursing that you actually have observed their process from, maybe say Nigeria, or from the UK, or from any other country.
I'm not too exactly certain on how the exact steps that you have to take. I do know, like, a lot of, especially at my job, we have a lot of people from foreign countries, the Philippines, we have a lot of people from China, you know, just different areas around. And they all, not all of them, one story that I heard was that she came with a student visa, and she came to school, she became a nurse, and I'm not sure if she has papers now, but she became a nurse through the student visa portal, and now she's working here. She stays here. I haven't asked her if she has to go back or anything like that, but I know currently now she has a license in Texas, and she stays. She works at Indiana. So.
That's great. How long is the program, the nursing?
Depends. So they have some accelerated programs, which are a year and maybe a couple of months. Those programs are typically harder to get into, and they, personally, I don't know, they're not as in-depth as the program as I went to.
Okay.
When I say that, those programs are sometimes online, and those programs are very, very fast-paced, very, very fast-paced. But normally, it will be 2 years outside of your basics. So if you're just coming straight from high school, you have to do 4 years, or maybe 3 years, depending on the school that you go to, because you have to take your basic classes.
Yeah.
You know, I told you I was going to school semester, so I had taken my basic classes. So I only had to do 2 years of actual nursing.
Okay.
And that's how long it took for me.
Okay. I know you mentioned in the beginning of the interview about how it's not just a static role. It's not just, you're just not going to be in one spot throughout your career. So where do you see yourself in the next 3 to 5 years?
I'm actually trying to go back to school.
Okay.
I've been applying. The application is just open on the 15th of the school that I want to go to. Okay. So I'm trying to get back to the school so I can go into my doctorate's DNP.
Okay. To be a doctor?
DNP.
Oh, DNP.
Doctors in Nursing Practitioner.
Oh.
Yeah. So there's a pathway that I could take that would take like 4 years, or three to 4 years. I can either go to get my master's in nurse practitioner, or my doctorate. So I'm going to get my doctorate because it's the highest level. It's only a year extra, so I might as well just do it. So I'll go get my doctorates, and there's a plethora of jobs you can actually get with your doctorates. Nurse practitioner. If you just want to go back and be a regular nurse practitioner, you can, or you can go be a CRNA and get another certificate on top of that for the CRNA school, or you can go, become a VIP in the hospital. You have to work your way up that ladder, of course, but there's just a lot of things that you can actually, or into education if you want to, stuff like that.
Sure. Thank you. Thank you for that one. So what would you advise anyone that's currently I know you gave them an advice already, but that's currently deciding, oh, do I want to be a doctor? Do I want to be a nurse? Or do I have to write the exam?
I think the best advice for anybody like that, do what it is that number one will make you happy. Number two, do something now. Like, of course, have time to ponder and think, but don't take 3, 4, 5 years thinking. Don't let life go past you and you're still thinking about what you want to do.
True.
And do something that you want to do, not what your parents are pressuring on you to do.
Not what your parents are pressuring you to do.
No, because that's the problem we all get, and we try to get into this and that, and 4 or 5 years later, we're still trying to get into this and that. We have procrastinated 4 or 5 years where we could have already been something with those 4 or 5 years.
Sure.
So do what it is that you want to do, and don't beat yourself up. Prayer is something that will always help you. And when you get to that point where you're just like, even before you get to that point, of course, but once you get to that point where you're just like, what do I do? Always go back to prayer.
That's
Always.
That's very big advice there. Prayer, pray hard. So nursing, typically in somewhere like Nigeria, you hardly find men. You see lots of ladies. Is that the same here?
No. I was actually surprised to see so many men. I mean, of course, the ladies outnumber the men, but not as much as I would have imagined before. There's actually a lot of men in my hospital, especially on, like, we have different teams and services. And like the IV team, we have a team that comes and puts in IVs themselves. And there's a lot of men. I actually need men in nursing, to be surprised. Every time I work with people, they always share their satisfaction with me, and I'm always helping my fellow women or nurses, move people and lift. A lot of times, especially in my hospital, people are bedridden. So we do have, I mean, of course, we do have technology now. We have things in rooms where we can strap to people, we can move them around, but that's not always going to be the case. Not everybody's pain can tolerate that. Not everybody can, surgery or cancer can tolerate that. So, and men there's a stigma in this profession that it's a woman's profession. It's not. It's not a woman's profession. I'm telling you now, it's not a woman's profession. There's a lot of things that you can actually learn from being a nurse that will follow you for the rest of your life. Like, there's so many lessons that I've learned from being a nurse, and I just don't take them for granted.
It doesn't make you soft. Huh?
No, not at all.
Okay, so just help me clear this opinion about being a black in America. Just very quickly, just the whole scare, racism talk. I know it's not our place to talk about. Just sort of wanting to encourage a lot of people that are thinking to move to the US and just practice being a nurse, and then there's that fear of, oh my god, what if someone just shoots me from
Yeah, America and guns are always in the hand. But like I said earlier, there's always a fear anywhere you would go.
True.
But one thing that you always can fall back on is what? Prayer.
Yeah.
You can't be fearful if you pray.
Sure.
You can't be fearful if you pray. Of course, there's racism everywhere. Of course, there's racism in America.
Yeah.
Me personally, I haven't experienced racism at my job yet.
And I hope you don't ever.
I hope I don't. I said yet, but I hope I don't.
Yeah.
I haven't experienced it at my job, and I don't plan on experiencing it. But if I do experience it, I always think back. It may be it from the patient. They're in this position. You don't know what's going through their mind. I'll always give my patients grace. Always. It may be hard sometimes because sometimes they may say some things or do some things, but always give them grace because they're always in a lot of stress.
Sure.
They're always in a lot of stress. But as far as racism, it's not like you just walk into somebody and they just call you the N-word, or they just I haven't experienced it. I mean, I've
been here a month and I haven't even experienced anything like that.
Exactly. Like most time, people mind their business. it also depends on the area. Don't just go to some area that's known for straight racism, obviously.
True.
But yeah, most of the people just mind their business around here.
So you've heard from sorry, you're
The
not
source.
a horse, but the source. Okay, the source. It's actually sort of it's safe. It's safe. Just pray.
Yeah, pray.
Wale says pray, so just pray.
Pray is
Pray
the
about
only thing,
everything.
because it's anywhere you go, anything can happen.
Yeah, true.
Anything can happen.
So Wale, I'm gonna give you a high five. Thank you for granting me this interview. And so now you're going to look into the camera and you're going to tell every watcher or every subscriber to watch, like, subscribe.
What's the name of the channel?
Young and Corporate Series. Or you could say Yaks with Lola.
Yaks with Lola. Okay, everybody. Thank you for having me on. This was a great interview. Watch, like, and subscribe to Yaks with Lola. And I hope to do this again one day.
Oh, sure. I'll be happy to have you again when you get the next
promotion. Right?
Promotion. Thank you.